briefly introduce yourself?
Yeah, as you said, I'm Raul Pita. I'm the founder and CEO of Protect Project. Protect Project aims to promote the well-being and the welfare of African families, particularly the children. Children are our future, so we want to make sure that they are growing up with all the abilities to excel in life. So that's why we created Protect Project.
And I know, Raul, last time you're familiar to AUK Radio, and the last time you were here, it was about raising an awareness about COVID, the impact of COVID among Black African families, and how that campaign went on.
So we had two projects. The first project was about the impact of COVID-19 on the African community. Mainly, we were looking at the health, the mental health, also the financial situation. So the impact that COVID had on them, because the Black community was at the beginning negatively impacted comparing to other communities. And the second project was mostly about the vaccine. We are looking at the safety of the vaccine, the efficacy of the vaccine, and the side effects, because many people were concerned about it, especially in the community, about that. So these are the two projects we had, and we have dealt with those situations.
But what inspired you to become involved in COVID vaccine? That I remember that was around the lockdown time.
Yes, when COVID-19 began, the African community was really badly affected. Later on, I think it balanced a bit, but when at the beginning, the African community was badly affected. And that was a wake-up call for us. We thought we needed to intervene, and that's why we set up that project to protect our health. You see, when your health is attacked, we needed to do something. And back then we didn't have accurate information as we have today, so it was a big challenge.
What challenges? I know it was challenged. It wasn't easy during that time. There were not many information when COVID-19 struck. There were not many information, but you managed to come on air here at UK Radio to raise an awareness around COVID from Black African minority ethnic here in Luton, Bedfordshire, and you invite people to take on vaccine to save us, to protect our families. And you said it was a challenge. What type of challenge, and how did you deal with them?
The first challenge, I would say, it was this historical mistrust within the Black African community toward the health providers in the UK. People were being skeptical when they were asked to go and get vaccine. They were wondering why this time around you're asking us to go first. Why we always been? That's what people are saying. We always been the last to get the provision in healthcare. So there was like a really deep mistrust, and also some have claimed that African people, especially Black people, have been used for experimental vaccines. So to them was like something in history was repeating itself.
Just history past.
In
time.
So that's the historical mistrust that people were a bit hesitant.
So in the past, Black people, that's one of the experience that you had with among Black African community that has been used in the past during the colonial time.
Yes.
As experimental.
Yes. People were mentioning that, and they said, is it going to be different? Also, they were wondering, they say in the UK, when there's like something new in health, is always the other community, the white people first. And then they say, why this time around is, they want to encourage to go first. They were like, no, that's a bit suspicious. So to us, it was kind of a barrier that we needed to overcome. Apart from that, we also have these cultural misconceptions, from both sides. You see, culturally, in Africa, we possess getting sick and the healing differently from here. In the Western world, is mostly okay. We like to find out in a scientific way what was the reason why we are sick, and then in the scientific way, what could help us to get better. But in Africa, we go beyond the scientific way. Obviously, we accept science, but people would like to go a bit beyond. They would want to know the cause, and beliefs and religion may come in.
That's in a personal way.
Yeah, I mean in a personal way, but people in the communities, they form a community because there are several people inside the community. So if you go different person who believe that way, so you need to consider that. Even the process of healing, some people will, okay, I'm gonna take the drug or the medication, but I won't forget this the aspect of praying and the spiritual aspect of that. So which could be a bit different from other communities. So this is another aspect of things that we needed to take into account when we are approaching people.
So spiritual, cultural aspect, those are values that we need to bear in mind when discussing response to any kind of illness.
Absolutely. Because the mistake would have been, you just come, you say, okay, COVID is here, COVID vaccine is here. Phase 1 is safe. You go and get the vaccine.
It won't work.
No, it won't work. You need people need their time. And then they have concern. You need to address this concern.
Do you think that was the cause? Because Black African, they were more affected during. Do you think that hesitancy of vaccine or the lack of information were one of the cause of the negative impact among Black African community, mostly in Luton, Bedfordshire?
Yeah, just to put the record straight, it's true that in the beginning, Black Africans were mostly affected, but with time, we realized that it balanced out. All the communities, regardless of their race, they were affected. So, but in the beginning, we thought the Black Africans were mostly affected for some reason, but we don't know why. Personally, I don't know why. But as the pandemic evolved, it balanced out with other communities getting equally affected. As you say, these are the barriers. That was one about the historical barrier. We have the cultural mistrust. That was also one of the elements, the factor that we needed to address. And the third one, I would say, is the language barriers.
So the language barrier.
Yeah, the language barriers was another factor that we needed to address. You see, in the community, we people have their mother tongues, so you touch their hearts better when you speak to them in their mother tongue, even though they understand English. You understand? So apart from that, even English itself, the English spoken on mainstream media is different from the English spoken in the African community, but it's still the same English. You see, when let's say it's not pidgin, isn't it? No, it's not pidgin. A Nigerian person who's convinced of something and then who wants to speak with conviction, he will speak in a way that another African person will feel like this person is really convinced about what he's talking about.
He's speaking my language.
No, even speaking in English. I'm talking about speaking in English. So because the tone of his voice, the emphasis will be different, but I'll give the example of the BBC, for instance. They were convinced that the vaccine was, but the way they were transmitting the message, it was a bit different.
And the culture of makes a difference. That cultural element makes a difference.
Yeah, I would say the communication, the way they communicate. I don't know if you have to put it, but the communication was a bit different. In Africa, when we're convinced about something, we speak. The intonation is the voice, the tone is different, the emphasis is different. Yes. Yes. So apart, obviously, from speaking to the people to their own mother tongues, where they're more affected. So we realized that social media, there were a lot of misinformation, but people were listening to the information on social media, even though they weren't accurate. It's because they could touch their heart. You see, they could touch their heart. That's why working with a community organization that knows the people will help, in reaching them and then passing the message.
Let's get back to vaccine. Why do you think that getting vaccine is crucial for people? Mostly, your community leader, you're a Black African community leader here. So what do you think that is crucial?
I mean, first of all, the vaccine will help to protect the person who takes it. When you're vaccinated, even if by any chance you get contaminated, the sickness won't be as severe as if you weren't vaccinated. You see, that's the main advantage.
So it mitigates the risk.
First of all, it protects you not to get contaminated, but in the rare case that even vaccinated and then you are contaminated, the severity of the sickness will be much, much less than the person who is not vaccinated. And since the severity is less, you don't need hospitalization, while a person who is not vaccinated will have sometimes to go to hospital and then stay in the bed. All of that leads to spending more income on health than we should have if we were all vaccinated. That's one advantage. And then I spoke about the historical mistrust, because some in the community came to us and said that there is like a gap between the health provision that Black people receive and other communities. But when the provision is there, why don't you take it? You see? So sometimes our own behavior contributes to this discrepancy.
But how do you address their concerns? Those are the concerns that we need to address. But how do you address them?
Yes, these are concerns that we need to address effectively. But addressing them, let's mention the case of historical mistrust. You need to approach the community and make a sense of try to make relation with them.
So you need to establish a good relationship with your own community.
Exactly. Yeah. Establish this relationship. How would you do that? You need to listen to them. You see, sometimes we think that we know and the other people don't know. But if they're thinking in a certain manner and they don't trust the system because of some historical reasons, or they have their own conviction, cultural or religious convictions, you need to listen to them. And it should be the real listening. It shouldn't be the listening where you are actually listening, but you are in your mind preparing the answer to give to that person. You need to show empathy. Listen, put yourself in that person's shoes. Listen to that person so that you understand what is the point, what is he has in mind. So we shouldn't be quick in passing the message. We need to be empathetic, listen first. And then from there,
Yeah,
you can
engage.
slowly, yes, you know, talk to the people. And then another way is not only working with organizations, we also need to work with health professionals from African background. We also have religious leaders.
But they follow the books, they follow the guidelines according to the legislation. So, being African, so do you think that being an African provision and addressing, establish a kind of a trust, isn't it? Because you belong to that community. The fact that you belong from that community and you, the one who are addressing the issues, the concern, it builds that, it reinforces that trust.
Absolutely, absolutely. And you will feel like the way you approach the problem, let the community appropriate the problem and then find solution. The mistake some have made is to tell people that this is the solution. Yeah, and it's kind of talking to it's a bit condescending. You know, it's like you're talking to children. Yeah, but when you pose the problem and the community come together and look for the solution and propose their own solution, the effects are much durable and much better than if the solution came from somewhere. It just come COVID first phase, you just go and take it. No.
It doesn't work like that.
Yeah, sure.
RAOUL has been contributing to Luton and Bedfordshire community for the past decade. So one of our trust community leader, and today is sharing his experience, wisdom, and knowledge around vaccine hesitancy. He led quite a few campaigns during COVID 2020 in terms of bringing awareness and impact of COVID among Black and African in Luton and Bedfordshire. Raoul, you shed quite light around vaccine hesitancy. I think you don't do that yourself. I think to achieve some of the aims and objectives, you need to partner with local organizations. How do you do you do that?
Yes, effectively, we partner with other organizations to do that. We've worked with some health professionals from African background. We also work with religious leaders in the African community. And I'll particularly mention AUK Radio because the first project we won was during COVID. And I remember that we have still a lot of restrictions, even when we were coming in the studio. Yeah, so we were kind of, we needed to respect the measure, the restriction measures, and we worked with AUK Radio. And back then, many people wanted to come in the season actually, and it was like no, there's just a limited number of people allowed in the studio because of COVID-19. So yes, we think that AUK Radio has helped us a lot, and I have a lot of feedbacks about the quality of guests that you brought in, particularly that counselor from the Luton Borough Council. Because I said the first project we had, it was mostly about the impact of COVID on the African community. And I remember this counselor, I think she was a counselor, a lady.
Jackie Bennett.
Oh, okay.
Bennett, yeah.
Yeah, and I remember she was a counselor. She is a counselor. She actually gave the right information to many people. But most of the people didn't realize that Luton Borough Council was still active, still helping, and the information coming from the source really helped. These are the sort of collaboration we need. We came to you, but you have access to the right people, and the right people came. I think you had it over the phone or she came in the studio, but she gave the right information, and then it helped a lot. People really appreciated what she gave us.
That's successful story, isn't it? That's what we want to hear when we engage in communities and when we addressing their concern. Can you share some some other successful stories there?
Yes, I would say, the second project was mainly like webinars because still we weren't allowed to meet face to face.
That was still around COVID,
It
or
was still that was the about vaccination, and we had webinars where we can talk to people straight on Zoom. What we did at the beginning of the project, we did some surveys and to find out where people were hesitant, how many were there, the percentage, and it was a quite, I would say 70 to 80% of people who were like no, they were hesitant. But and then we have another survey at the end.
at the end of the
At
project?
the end of the project, we noticed that many people, we had like a double, like it completely changed. Like nearly 80% of people were willing to get a vaccine.
So people change.
Change, yeah. But this, what was interesting, I can just mention one. This lady who, at the end of the project, she called me and she said, "Listen, I actually, follow some of your workshops and webinars, and that was really interesting. But me, I'm really, really against the vaccine, and I feel like I'm not convinced. But you know what? I would still take the vaccine." So I say, "Okay, see, if you're not convinced, why have you decided to take the vaccine?" And she said, "It's about something that you said. I mean, some interview said. They said, if you don't want to do it for you, for yourselves, at least do it for your children. You see, in the African community, this is one of our values. We live in really
Community,
close
family.
family. Even if you don't have children of your own, you are still an auntie or an uncle.
We always like to be surrounded, isn't it, by
Yeah,
families, events, gatherings.
yes. And then people are like, okay, you could say, okay, me, I don't have any child, or all my children are grown up. I don't care. If I die, this is my problem. But what do you think of your nephews and nieces? So somehow they were kind of affected. And this lady, particularly, she said, okay, I'm not convinced, but I want to do it for my children. I don't want to die and then my children looking at me and saying, Mom didn't get the vaccine, and then we are all on our own because of Mom. So yes, it was encouraging to hear such testimonies, and
Definitely.
and we're really proud of having participated into this.
That's what we want to see, is the change of mind of people. The lady, she did it for the people around her.
Mm-hmm.
That's what we call change. Have you seen any other people who, since they had vaccines, COVID we're talking about, and they changed their mind? Did they come up with any particular stories in terms of discouraging others not to get vaccine? Personally, I never had any since people around my community they've been considering the fact that to have vaccine, COVID vaccine.
No, what we did in the project was to present the accurate information. We didn't want to go really embarrass people and asking them why they don't want to get vaccinated in much details. If they wanted to express themselves, that was fine. But we were there to listen to them.
What can we do?
Yeah, what can we do? And now it's more obvious. People more understood that we should get vaccinated and are getting vaccinated. Some were saying that we're gonna die within a year, and then you take the vaccine and you're still around. A lot of ladies who were wondering about the side effects because she wanted to have a family, and then she was wondering if she's gonna get pregnant if she was vaccinated, and then she got vaccinated. She has a beautiful child. So these are proofs that the vaccine is safe, and then we can trust the vaccine and get vaccinated.
Based on your it seems that you do have quite huge experience around raising awareness of vaccine. You led that during COVID 2020. Based on that experience, what recommendations can you give to people of your community to approach, like you define it in the area, health provision in terms of listening more or exchanging, sharing information, being more open?
Yeah, I think we need to collaborate. That's the key word. We need
Collaboration.
Yes, collaboration. Let's work together. If you don't like the word collaboration, I would say work together. Let's work together with the health service provider. Let's work together with the local authority. Because we are the first to complain that there is a gap in health provision with other communities. But when the provision is there, we are not keen to take it. You understand? So we need to really, I would say, reduce the gap, even not to close it. It's sometimes it's our own behavior. It's not really that the gap. It could be true that some circumstances have done that there is a gap between in provision of health between communities. Yes, yeah, it could be true, and I think it is. But when the provision is there, how would we be? We should be quick to get the provision available for us, and then reduce that gap. It will help us, and then it will help our children. If we have this attitude of always referring to the past because some bad things happen, we're not gonna go forward. Yeah, we really need to go forward. Work together with the local authorities. Work together with the health service provider, so that we can make our life better, especially health-wise. Because when we are healthy, that's also another message that we are talking about. Protect Project really care about children in the African community, but the child is under the responsibility of the parent. Understand? So how the parents will look after the child if they are not wealthy? Not wealthy, but healthy.
Healthy.
Yeah, if they're not healthy. So they need to be healthy to look after their child.
Very important.
And take provision of whatever is available.
I think it's the same message, isn't it? You share with local authorities, with, as you say, in terms of collaboration, partnership. So you do partner with local authorities and health provision. So those are the message that you share when we are with them in terms of how to approach it as well, your community.
Now, with the local authority and then other organizations that are not within the Black African community, is a kind of different message.
Okay.
They should use empathy. They should listen not just to provide the solution, because sometimes, as I said earlier, you listen to give a response, but you're not listening to understand the person. So they should show empathy and listen to the community so that they understand what is going on in the community. And they need to be culturally, the message is culturally sensitive. They need to understand that. They shouldn't approach the community, the Black community, without care. Otherwise, the effect will be the opposite. They won't listen to them. They won't trust them.
So, as you said, people on your community, Black and African community here in Luton and Bedfordshire, the historical past that slowing them down to trust the health provision. By your message of trust, because of you as a community leaders, you know their concerns, their concerns are your concerns as well. Because you know them, you know how to address their concern. That's why you setting, you're between local authorities and the community, and you building that trust, and you seeing the change that lady went on to get a vaccine. And there are other positive examples as well of people who building their relationship with the local.
Exactly, Junior, you really put it right. Exactly, that's what's happening. We want to be like the middle people between the local authorities and the health providers and our community. So if they trust us and then they want to work with us, I think it will be easier. Sometimes it's not only that we are willing or we want to be like these middle people who want to put themselves forward. No, our main objective is to work for our community because we're part of the community. We don't want to be look down at like people who are not able to bring their own solutions to the problem of the community. But it's happened that we has become community leaders and we want to interact with the local authority and then other service providers. Them on their side, they should be willing to listen to us too. That's the problem sometimes. Yeah, sometimes they're not available. Junior. I would like to pass the message. I know that you're in touch with them. Pass the message. They need to be available. I'm telling you, Junior, sometimes they are not available.
Available on the concern or available physically when the community need them?
No, it's available on the concern even physically. But physically, it could be they will be limited to where to be. But on the concern of community, sometimes they privilege few communities and forget about others. We are all in the same boat.
That's a concern that's another concern that we need to raise. It will be in another issues, another topics, another shows that we sit down and voice up the concern coming, because what you're saying is the concern coming from your community.
Yeah, exactly.
So that's will be we'll come back to that and have a particular show for that where we will address the concern coming from your community. As we conclude, Raul, what particular message you would like to leave to your listener, to our listener, is specifically people on your community, Black and African community in Luton here and Bedfordshire, who are listening to us now?
Oh, is already done?
As we conclude.
Oh, we're concluding. Oh, it went.
Already.
It went. You need to invite me for another show.
We will come back for another show because I know right now the production team is focusing on the time which has been allocated.
Okay, thank you very much. But as you said that we will have a show with the local authorities or talk about how we can work together.
Definitely.
I'm really passing the message to you. They need to be more available so that we can talk and see how we can solve problem within our community. They shouldn't focus on the same community they're focusing on. No, they need to contact everybody. Even those that think that they're small, they're not available. They need to be available for them. So if there is a show that will involve some of the local authorities and us, me personally, I'm available. I will come. I will be available for them. We need to talk and then be fun. Now, when it comes to the message, I would like to tell all the listeners of AUK Radio, particularly the Black and African communities, that you need to seek for the accurate information, particularly health information, to the right source. Contact your community organizations. They are trusted communities based in the UK. Pay attention, be careful to whatever we listen on social media. These people will bring you inaccurate information. Make sure that you listen to trusted people community leaders in your community, organizations in your community. We always complain about, people have been complaining about it, that there is a discrepancy between our community, the Black community, and other communities when it comes to health provision. But when the provision is available, let's do our best to get it. Sometimes it's our own behavior that's creating that gap. We should work together, friends. Let's work together so that we can continue to work for the well-being of our community and the well-being of our children.
Thank you, Raul. Let's work together for the well-being of our children, our families, and our community. That was a message for Raul with regard to vaccine hesitancy. Let me remind you, Raul Pita is the founder of Protect Project, which is African safeguarding African children and families, non-for-profit organization based here in Luton. He is also the co-founder and director of CD Return, which is Congolese diaspora networking companies. Thank you, Raul, for your time with us. We hope to bring Raul next time in another show, in another particular episode of Inside Out, where he's going to voice up, address the concern of coming from his Black and African community here in Luton. Thank you for you've been there listening to us. We will come back next week, Saturday, with another show and another inspirational guest. Bye-bye.